Hi, I am Adam Pearson. I am doing my fourth video on ketamine. I have switched from IV um, infusions to sublingual, which is under your tongue. And there's four ways ketamine can be administered, which is through pill or sublingual lozenges under your tongue, nasal, and then, of course, IV, which has been the predominant way, but COVID actually has opened doors for people to get treatment at home, and it's 1/4 the cost of IV infusions. Now, and I mentioned previously video, and I mentioned previously in an earlier video that uh, ketamine absorption is going to be less by sublingual or pill. There's a very little difference. Under your tongue, there's a little more absorption rate, around 20-25%. Uh, Nasal Spravato is the FDA approved, but that's $900. You order it from, there's many companies that do it online. It's typically 30-50 bucks. So that shows you how much profit these pharmaceutical companies are making. But that's another issue. They probably need some ketamine infusions. Maybe they lower the price. But anyway, oral or nasal is about 50% absorption, and so depends on your dosage too. So, I'm mentioning these like sublingual, which is just means under the tongue, right? But it's good to learn the lingo. It's good to learn about dosages because it's really not complicated. Medicine, medical, the medical world, 50% of it is common sense, running the right test, uh, uh, treating depression, medical, right? Not saying there's not contraindications to medicines and so forth, but finding the right dose of a medication is just the optimal dose for anything: depression, anxiety, bipolar, schizophrenia, a mood stabilizer, an antipsychotic, an SSRI. Ketamine just requires you start low, go up slowly until the patient receives the optimal benefits with the least side effects. It's the same with ketamine. So typically the starting dose is 0.5 milligrams, and it goes all the way up, which is 50 milligrams, goes up to 300 typically. Now that's for the treatment of psychiatric disorders. If you're going for chronic pain on the side, it is much higher. Dosage up to 700 milligrams, oral, and I think by IV infusion. An IV infusion for PTSD, OCD, depression, an addiction, that's typically 45 minutes to an hour. Um, Chronic pain is around 2.5 hours and more expensive. But you can be treated for chronic pain at home with ketamine. So, um, and I tell you, ketamine continues to amaze me. There has been no treatment, therapy, medication, nothing has compared to ketamine for me. And I have practiced for 12 years. I have been a patient for 15. Um, I Other changes I'm feeling, it's not just the depression lifting my mood. I'm in a good mood. And there's room for improvement, I can tell, but it keeps going like 10 severity, which I was about an 8 or 9 overall before starting ketamine in my life. I mean, I could function, but it was a fight to be happy. Uh, Most people wake up in a good mood and they stay that way throughout the day. I've never really had that. I've had parts of my life when just things were going very well, but it was very, very minor, at least in my memory. And most people could attribute, would advocate for that. But my mood, I'm joking more. I am laughing more. I am just in a good mood. I'm more calm, and that's the one thing today I noticed. Um, and it's been about 4.5 weeks since I've started ketamine, maybe 5, and I'm not on edge. I am not ready for something, waiting for something to happen, but subconscious, like ready to jump or startle. And I was walking today, and there was this little kid on the bike on the path. It's a little half-mile trail around a pond at the park right across from where I live. And typically I would have jumped, just and made that sound. I've done that my entire life. I didn't do that. Now I did jump, startle, but we're talking 50 to 60% less of a reaction that I don't even control. It's a reaction, just boom. So used to it. So my brain is changing. And there are times I can feel it changing, and you just have to experience ketamine to fully understand, because ketamine does stay in doing its thing, neuroplasticity, rewiring the brain, creating new neural pathways. And when I say that, so imagine there's two roads. You're in front of two roads, and you've been going down these two same roads in a situation or overall with anxiety or depression or anger or whatever. And your brain creates, or your brain does create with ketamine or with therapy, medication, other pathways that you can go down to choose from. But ketamine, it resets it. It's on a different level, like where there's two roads. Therapy and medication might give you the ability to go down those two roads that you've been going down with a much lighter load. But ketamine creates new roads that you get to go down. Where I would typically have rage if I'm triggered, uh, I have a choice versus just diving into it, or it's not as intense. It's just lifting. Like everything is just lifting off me. Um, and sleep. I typically was sleeping 9 to 10 hours. That was my biology since I was a kid. Um, that's a good night's sleep for me, and that's normal. Your biology. It's not every 8 hours is not for everyone. Some people need 6 to 7. Some people need 9 to 11. Everyone is just a little different. It's when it's less, and so which would make sense since again, ketamine also is correcting the receptors that let off the dopamine, the norepinephrine, the serotonin, and others. These are just, I mentioned the major ones that we hear about. And what ketamine does, again, it releases glutamate from MDMA receptors. I know I'm talking very clinical right now, but uh, maybe to encourage you to learn about this because it is fascinating. But the science of this, and it is very researched compared to 10 years ago, which they started really getting into it, brave clinicians, brave MDs, nurse practitioners, whatever, because it takes courage to use a drug that most people demonize, which I did for a year because I knew it was a party drug, Special K. Well, but guess what? It's also used as anesthesia. It's also used in the ER. And so when it's working on your receptors, so imagine a brain that's had a lot of trauma and anxiety. Okay, and it damages the receptors, especially as a child. And I had a lot of trauma as a child at school, being bullied, and the fear of what would happen to me every single day for years and years, K through 12, especially in high school. I would be trembling inside. So my fight, flight, or freeze, my brain's going like this all the time. Well, now, so there was depression. So someone that's depressed, the receptors are going like this. But with ketamine, more dopamine, more serotonin, more norepinephrine. And I have ADHD, and that diagnosis was a year ago and 2 months. And Adderall was the first medication, Adderall XR extended release, and I take an instant release, which that's a whole different video. But that was the first relief I got from depression and increased good mood. And actually, stimulants, there's typically 6 for ADHD, are also used off-brand, as they say, for treatment-resistant depression, which again, depression where at least two medications have not worked. You're resistant against it, and because the good thing is about a stimulant, Adderall and Ritalin, whatever, but Adderall is mine, and that's there's no side effects. I mean, very or minimal side effects. It works right away. Mood improvement, calms you down. Even if you don't have ADHD and you have treatment-resistant depression, you feel better because it's simply chemistry. It releases dopamine and norepinephrine into your brain. And so the reason I mention this is because as my brain is healing and changing, the Adderall, I hypothesize, to be honest, as a researcher, I went for 2 doctorates, had to learn research out the ass, and I hypothesize that the stimulant, the Adderall, is working better overall for my mood, for my attention, focus, motivation. Um, and it's going to be interesting to see. And I'm going to try actually to be part of that research. I think it needs done because this is a game changer. It is a lot of people use the word cure. I would definitely it's close to a cure for depression and anxiety and trauma that I have ever seen. Um, and I'm experiencing it. I'm about to see a friend. She starts this weekend. She sees the doctor, and same one I have. And you're going to see different. And I encourage you learn about everything. But for example, ketamine, 80 to 85% people respond. That is huge. SSRIs, antidepressants, SNRIs, typically all Paxil, Effexor. There's so many, Celexa, all those. Uh, Typically about 40% respond good, well, and it takes weeks. This works right away. It's safer. You don't have to take it every day. And it's permanent. It is more permanent. And I will tell you a big question I have, which I found the answers. It's uh, from Australia, from doctors. There's research studies there. And um, ketamine is not lifelong. And people say, oh, well, when you stop it, everything goes back to normal. No, it does not. They have found that within patients, 30 months is kind of been mentioned by doctors and research so far, but about 30 months of ketamine, which is just a booster shot or a booster IV, booster, however, ketamine is ketamine. It's going to work on you. The absorption rate just means you might have to wait a little bit longer for the effects to take on, but ketamine is going to work. Uh, but 30 months, a lot of people, there was a doctor, he had mentioned it was about 80% of the patients stopped and they didn't need any more because it becomes permanent. So typically by IV infusion, which nothing wrong with any way you get it, but IV infusion, you do 6 within 3 to 4 weeks infusions. And then there's maintenance, which typically every 30 to 90 days. It just depends on how you respond. If you're at home, do treatment at home, which again, typically the cost of an IV infusion, which includes the doctor visit, the prescription being sent to you. The prescription is typically $30, $30, right? A nurse practitioner, some of them have a nurse practitioner watch while you do it at home just to give you support or if you need anything in case of an emergency. But I have not heard of anyone needing emergency services with ketamine so far. And I've researched this for a year extensively. And so I lost my train of thought. Sorry. But it's good. I don't even know where I was going with that. I apologize. So, um, oh, yes, at home. Ketamine after. So once it's established, the installation phase, one I refer to it as where it's kind of getting it infused very into your brain, getting it solidified, kind of a baseline, and then keeping it growing and keeping changes that have been made stagnant. They become the new normal, right? We hear with COVID and mask and all that shit. The new norm, it's not the new normal. It's abnormal and it's not good, I don't think. But that's that's my opinion. And anyway, um, but creating the new changes in your brain, maintaining them, and strengthening these new neural pathways, strengthening neuroplasticity, which means new life in your brain. You hear these words, but if you know the meaning, neurogenesis, that happens with ketamine. Same thing. It's creating new pathways, new life, correcting your brain receptors that you're taking all this medication for your maybe for years, 20, 30 years even, for depression and anxiety, and trying to get more of the serotonin, these receptors to release, and it's correcting them to where you don't have to take medication. I am not on an antidepressant. First time in my life. I've been on Celexa, Zol. I mean, you name it. Since I was 24, I have not. I've always been on a antidepressant, uh, uh, SSRI, and I'm not. So this is coming from a clinician and a patient, and um, it's great. It's just, and basically, I agree with a lot of the providers. And a lot of some of the providers have went through it themselves, and I really think anyone that is practicing therapy or even ketamine, at least get one infusion to see how it is, because it just gives you a more robust, deep ability to do your job and to understand what the patient is going through and the questions, and it helps the whole process. But the glasses that you've been wearing of depression and trauma and anxiety get taken off, and you get to put on new ones that are more based in truth. Because the perception of everything, you, the world, how you think the world sees you, God, changes with healing, with truth, with gives you a better, and helps you to cope, helps you to manage. It helps you to do therapy better. It helps you to just experience happiness and joy, which I think is much stronger than just saying happy without fighting to feel it. If you've been in that depressed state like I have most of your life, you get to wake up and feel like other people, because, and it's not your fault. And I know that guilt of feeling like, what did I do wrong? Why am I feeling depressed? What did I do? What do I need to do to fix this? It's on me. It's not your fault. You do the best you can. But there's a new option, and it's a very highly recommended research. They try to minimize how strong the research is. Well, it's FDA approved. Spravato, which is a nasal, it's ketamine, so it's FDA approved. If that, and that is important. It's government, but still, FDA approval means there's been a lot of research. So they just, an IV is not FDA approved, but that means insurance companies, because if it's FDA approved, then insurance companies have to pay for it. Money, though, it's there's so much of that involved. I'm telling you, though, it's FDA approved. Nasal, that means ketamine works. So uh, hope this helps, and see you after a couple more oral infusions or oral ways to get it. See, I'm messing up on YouTube, and probably other people make new videos. I don't care. I don't care what people think. People can comment and make fun of me or give thumbs up. That's cool. But I know that I know I'm loved unconditionally by Jesus, and what he says goes. If he's God, that's what I believe. And I've done the homework on that too, and I believe he is risen just as he said. Have a good night.